Thank you for joining me today. We're going to be talking about nutrients that support the neurological and hematopoietic system's health. And we're going to start out talking about blood and just do a little overview for you. And you know that blood, of course, contains red blood cells and white blood cells. And what you see in the picture here, these little ones here, these are the red blood cells. And then here, the bigger purplish looking ones from the dye that they use are white blood cells. So red blood cells are called erythrocytes, and they're the most prevalent type of cell that we have in the blood. They contain a molecule called oxygen. They contain a molecule called hemoglobin. Hemoglobin is responsible for transporting the oxygen in our blood. We also have leukocytes, which are referred to as white blood cells, and these are part of our immune system. There are 5 different types of white blood cells, and the first one is a neutrophil. So neutrophils are going to help us to fight bacterial and fungal infections, as well as some of the lymphocytes, which are our T cells and B cells. These cells are also helping us to fight infection. Now, also, they're going to help us with viral infections as well. But B cells are secreting antibodies, and T cells are responsible for helping to kill off bacteria directly or to kill off cells that have been invaded by viruses. Monocytes are also referred to as phagocytes, and these are cells that go throughout the system, in the blood, in the tissues, and they're looking for foreign invaders. And when they find them, like little Pac-Man, they're going to eat them up. The next white blood cell is an eosinophil. Eosinophils are going to help us battle allergic responses. And then basophils help to control inflammation, and they also increase if there's any kind of poisoning that may be occurring in the body. So these cells are just showing you kind of a flow chart of how red blood cells and white blood cells are produced in the body. And we start out with what's referred to as a stem cell or a hematopoietic cell. So these cells, like any other stem cell, can turn into any cell in the body. But these stem cells are being given instructions by the body to turn into particular types of stem cells. And one of those stem cells could be what's called a myeloid stem cell, or you could have a lymphoid stem cell. Now, the myeloid stem cell can then turn into certain types of cells that are going to eventually go through steps to form an erythrocyte or a red blood cell, or to go through these steps here that will form an eosinophil, a basophil, neutrophil, or even a monocyte. And we're going to talk about platelets in a little bit, but then we can also form platelets. The lymphoid stem cell is going to then produce T cells and B cells, or T lymphocytes and B lymphocytes. Now, platelets or thrombocytes, these are small pieces of a cell. So let's go back here just for a second and notice this cell right here. This is a megakaryocyte. This megakaryocyte, some people believe it explodes and then the platelet is all these little pieces, or the megakaryocyte basically kind of pinches off and pieces of the cell come off, and then you get these platelets or these thrombocytes. Now, these platelets are going to help us with coagulation. So if you're bleeding, you get a cut on your arm, you don't want that bleeding to continue to go on and on and on. Of course, you're going to die from that. So platelets are going to help to plug up that hole, and they start the coagulation process. And we'll talk about that whole process a little bit more in a second. But you can see in this picture these little tiny, looks like little pieces of cell. These are the platelets. Now, another component of the blood would be the plasma, and the plasma is the liquidy portion or the extracellular portion of the blood. Now, blood is a type of connective tissue. Connective tissue, in order for something to be connective tissue, there are three components. So one of the components is you have to have cells, which of course we have the white blood cells, the red blood cells, we're good with that. The second component of connective tissue is that you have to have fibers, which are types of proteins, and we'll talk about the fibers in a little bit. The third component is you have to have a matrix, or that fluidy portion of the connective tissue. And for blood, that is the plasma. So when you're looking at blood separate, you can put blood into like a test tube and you can put it in a centrifuge, which then spins that blood really fast. And the heavier components of the blood are going to fall towards the bottom of your test tube. And the heaviest of those components are going to be your red blood cells. And the lightest component is the plasma, which is carrying other things like your proteins, and it's carrying basically different types of minerals and glucose and different things like that. White blood cells and platelets are found kind of in between those two. And so you can see the separation of whole blood. So going back to red blood cells, they have two basic functions. The first is to carry oxygen from the lungs to the tissues. And then the second is to carry carbon dioxide from the tissues back to the lungs so that you can exhale that CO2 out of the body. So the oxygen is being carried to the tissues to help to produce energy, and you have to get the CO2 out of the body, because if carbon dioxide builds up in the body too much, you actually use that carbon dioxide to produce acid. And if that acid builds up from the buildup of CO2, the pH of the body is going to drop. And our body does not like any types of drop in pH. It can cause all kinds of damage. Now, red blood cells contain a large iron compound, which is the hemoglobin. Now, before we talk about hemoglobin, I just wanted to show you a picture of a red blood cell. And the red blood cell is what we would call a biconcave disc. So it dips in on the top, it dips in on the bottom of that red blood cell. And the reason for that dip is because it makes the red blood cell very thin in the middle, and it allows oxygen to then easily diffuse into the red blood cell. The other thing is it also makes that red blood cell very flexible. And that flexibility is important because red blood cells are moving through all of the vessels, and they're kind of having to twist and turn and bend in order to get through those vessels. So the hemoglobin inside our red blood cell has a couple parts to it. First, you have 4 kind of twisty looking globs of protein. This is the globin portion of our hemoglobin molecule. And then in blue and red here, this is what's referred to as the heme portion of the hemoglobin molecule. And that heme portion contains iron. And that iron is actually what gives our red blood cells the red color. And the oxygen is going to bind to that iron. Now, one of the other things you need to know is you can have up to 4 oxygen molecules binding to one hemoglobin. The more oxygen that's bound, so let's say you have 4 oxygen molecules on a hemoglobin, the darker red the hemoglobin color is. If I start stripping oxygen molecules off one at a time, it actually starts to change the color of the hemoglobin, and it becomes lighter and lighter and lighter pink. And that becomes important when we start looking at red blood cells, especially to diagnose different diseases. We're looking at the size of the red blood cell, the shape of the red blood cell, and the color of the red blood cell. So if the red blood cell is a normal size, it's what we would call normocytic. If it's too big, it's macrocytic, and then too small is microcytic. If we're looking at the color of the red blood cell because of the hemoglobin, normochromatic Chromic is the normal color. Hypochromic is typically too little hemoglobin, so my red blood cell is going to look lighter and lighter in color. And then we can also look at the size of our hemoglobin here, or excuse me, our red blood cells. So this is normocytic, microcytic, macrocytic. And then this is our normal chromic color. And if you're looking at this under a slide, it obviously it doesn't look black in the middle, but it'll look kind of a whitish color because the light is bouncing off of it. And then because there is so few hemoglobin in this red blood cell that's hypochromic, there'll be a much larger patch of white in color. Now, normocytic and normochromic are our normal size, normal color red blood cells, but you can have red blood cells that are going to look different when somebody has anemia. So these are red blood cells that are not healthy, and this could be due to a number of things, but for instance, low production of red blood cells, low amount of hemoglobin in red blood cells. You could have a loss of red blood cells, like for instance, while a female is having her menses, she's losing red blood cells, or you could even have destruction of those red blood cells. And of course, the big symptom is I don't have enough oxygen. And if I don't have enough oxygen, I don't have enough energy. And I'm super duper tired all the time. So red blood cells can also be large, macrocytic, or we could call it megaloblastic if we're talking about B9 or B12 deficiency. So folate and cobalamin deficiencies are a sign of this. Small red blood cells, microcytic or pale in color, which is hypochromic, and we'll talk about this. It could be due to iron or even B6 deficiencies. So again, macrocytic or megaloblastic anemia can have to do with folate or B12, microcytic, iron or B6. And so this is showing you in the top picture here, normal red blood cells. And down here you can see how there is much greater areas of white compared to like maybe right here, this is a little bit normal looking. This is very hypochromic. So here's a little chart showing you some of the things that the different nutrients that we have to consume are going to do for us as far as supporting blood health. And we'll talk about these, but vitamin B6 is helping us to synthesize that heme, which is part of our hemoglobin and contains that iron. Folate, vitamin B9, is helping us with DNA synthesis and allows for proper cell division, as well as vitamin B12. Vitamin C enhances absorption of what is called non-heme iron, and we'll talk about what non-heme versus heme iron is all about. Vitamin K activates clotting factors. Iron helps us with DNA synthesis, and it's part of that heme. And then copper helps us to transport iron through the blood. So if you're cut, you're bleeding, and let's say it's a pretty good size wound, one of the very first things that are going to happen is you're going to experience vasoconstriction. Now this vasoconstriction can be very powerful. As a matter of fact, I've seen it where somebody's femoral artery was cut and they're bleeding profusely, and all of a sudden that artery vasoconstricts, and it vasoconstricts so much that it completely shuts off blood flow through that femoral artery and the bleeding stops immediately. So vasoconstriction is the narrowing of blood vessels, and it can narrow so much that it can clamp down and close down and stop the bleeding. Formation of a platelet plug is one of the other things that's going to happen. So as the blood is leaving, you have these little platelets that start to stick to the underside of the wound, and those platelets are very sticky, and they start adhering to the wound and then sticking to each other, and they form this plug that helps to seal off the wound. Now, If you need something a little bit more than that, you're going to have coagulation. And this is where basically the blood changes from a liquid to a solid. And this is going to reinforce your platelet plug. And how we're going to do this is we're going to use a protein called fibrin. And I'll show you how that's done in just a second. Now, hemorrhage, of course, is the opposite of what we're talking about, the stopping of bleeding or the hemostasis. Hemorrhage is an uncontrolled bleeding, and so your blood supply is going to be depleted. Vitamin K can be synthesized in our gastrointestinal tract, in particular in the large intestine, but that vitamin K is actually being made by the E. coli that lives in our large intestine. But the E. coli only makes about 10% of what we need. We have to eat the rest of this type of vitamin K. And what is going to happen is vitamin K helps with the blood clotting process. And in particular, it's going to activate a chemical called prothrombin. And what that does is it causes prothrombin to turn into thrombin. Thrombin then converts something called fibrinogen into fibrin. Okay, so we'll talk about what this is all about in just a second. We also use vitamin K for bone health, and we talked about that in the last video. So this is just a very short step-by-step of what we call the clotting cascade. And the final outcome, I want you to look here, is making all these little kind of rope-looking structures, these proteins. This is fibrin. And what fibrin does is it does this kind of hashtag type of thing where it's creating a net that then catches red blood cells and platelets and creates this clot. So you have some kind of trigger that is from tissue damage, the person is bleeding, and now you need vitamin K. Calcium is also very important, and it's going to activate what we call clotting factors. So we're going to go from these inactive clotting factors to active clotting factors. And now there are a lot of steps in this clotting cascade. We're not going to go through them all. But basically what's happening here is you're going from prothrombin to thrombin. Thrombin then takes this fibrinogen, and we call it a soluble protein because it basically dissolves in the plasma portion of our blood, and it's there all the time until thrombin comes around and converts it into insoluble fibrin, which then forms this mesh network in the blood, and you get a blood clot. Vitamin K deficiency is a big deal in infants because when infants are born, they're born with a totally sterile gastrointestinal tract. They don't have any bacteria. They don't have the ability to produce vitamin K. And so what we do is shortly after the baby's born, we're going to give them injections of vitamin K in order to make sure that blood clotting can occur until they get their own gut bacteria. Now, in adults, deficiencies can occur if you've been taking antibiotics or, for instance, if somebody has some kind of fat malabsorption problem, because you have to have fat in order to absorb vitamin K through the wall of the intestines, because vitamin K is a fat-soluble vitamin. So the daily dose is about 90 micrograms per day for females, 120 micrograms for males, and there's no reports of toxicity with vitamin K, so there's no upper limit. One of the things you have to watch out for is the older a person gets, the lower their intake of vegetables, which you would think that would be opposite. You think little kids would take in less vegetables, but I guess as we get older, we're like, well, there's no mommy around to tell us we have to eat our veggies, right? And then, of course, veggies are a little bit more difficult for a lot of elderly people to chew and to be able to digest in their system. Food sources of vitamin K: liver, dark green leafy veggies like broccoli, asparagus, and peas. Now, the nice thing is when you boil vegetables vitamin K doesn't break down easily. So it's resistant to that heat or that cooking loss. And absorption requires dietary fat, like we talked about, and adequate pancreatic secretions, which would be the enzymes that help to break down that fat for digestion purposes. Now, another thing to think about with vitamin K is coumadin or warfarin, which they're the same thing. So there are some adults who have to take this medicine in order to prevent blood clotting from occurring. So coumadin or warfarin inhibits vitamin K dependent coagulation factors. So what happens is it turns off that coagulation cascade and you can't make the blood clot anymore. So when taking coumadin, you have to keep your vitamin K intake consistent from day to day. And the reason for that is because, let's say one day I eat way more vitamin K than I normally would. I may end up being able to make blood clots because I didn't raise my level of coumadin. Or if one day I eat way less vitamin K than normal, then I may have way more internal bleeding that occurs because I can't produce any blood clots. So some of the food sources of vitamin K we already talked about, but those deep green leafy vegetables, really big. I mean, look at the percentage for spinach, and then broccoli, Brussels sprouts, rhubarb. Not a lot of people eat rhubarb anymore. My father was a very good cook, and he used to make a rhubarb pie, and that might sound gross, but oh my goodness, that was so good. All right, so we've talked before about folate or vitamin B9, so I'm not going to spend a lot of time on the B vitamins that are involved in the blood and in the neurological system, but just kind of to go over these a little bit. B9 is very helpful with cellular division. It's a coenzyme. It helps to provide methyl groups that help with our epigenetics and other things that go along with the DNA. It also helps to convert homocysteine to methionine. And then the synthetic form of folate is called folic acid, which is used to fortify foods. Now, folate deficiency, what it's going to do is it affects early red blood cell synthesis so that immature cells cannot form new DNA. So the cell grows larger because it doesn't have enough DNA to regulate and control that cell. And so you get large forms of red blood cells, which would be macrocytic, or we call it megaloblastic. And so this can be what we would refer to as megaloblastic or macrocytic anemia. And the symptoms of this would be a really inflamed tongue. Now, that doesn't mean that the tongue is red as far as inflammation so much, but that the tongue is very large. And for some people, the tongue can get so large that the person has a hard time talking. They're kind of biting the sides of their tongue. Sometimes even the tongue is so big, the person feels like it's choking them. So then you also have diarrhea, poor growth, mental confusion, depression, and then nerve dysfunction. So again, with megaloblastic anemia, you don't have good RNA synthesis, your DNA synthesis is impaired, and so you get these big cells. And they have immature nucleus, but very mature cytoplasm. And so here in this picture, that's what it's showing you. You have a smaller red blood cell here because these red blood cells can divide without any problem. They have enough B9 and B12. These red blood cells are unable to divide, so they become very large or megaloblastic. And here's another picture of like a regular megaloblastic red blood cell. That's a huge red blood cell compared to, let's say, normal right here, or normal right here. And some of the food sources of folate, because remember, we fortify wheat and grain products with folate, so cereals, tortillas, breads, they all have a lot of folate. Green vegetables, again, like asparagus, spinach, broccoli, and liver, beans like lentils, even sunflower seeds have a good amount of folate. So vitamin B12 is also known as cobalamin or cyanocobalamin or even methylcobalamin. Absorption of vitamin B12 can't happen if it is bound to proteins in the food. So what has to happen is the stomach releases acid, and that acid helps to dissolve the proteins and release the vitamin B12. Now, in order for B12 to be absorbed through the wall of the stomach and into the blood, you also need what's called intrinsic factor. So intrinsic factor, as well as our stomach acid, is released from cells in the stomach called the parietal cells. And without those parietal cells, you're not going to be able to absorb vitamin B12. B12 can also be stored in the liver for our needs. Now, if there is an absorption problem of vitamin B12, we have what's called pernicious anemia. And pernicious anemia is an autoimmune disease. Now, what this autoimmune disease does is it destroys those cells in the stomach, those parietal cells, that secrete both the stomach acid and the intrinsic factor. And so you can't absorb the vitamin B12. So when you have pernicious anemia, of course, the big deal is going to be fatigue, but you also have macrocytic anemia because those red blood cells can't divide. This produces a sore mouth, depression or apathy, mostly from the fatigue, back pain. You can have nerve damage with peripheral neuropathy, weakness, paralysis, and even death from heart failure. So this B12 is a problem for some people because it is found in only animal products, and those people who are most at risk are going to be vegans for B12 deficiency. So in order to have enough B12, you might want to have a clam bake because let me tell you, that is a lot of B12. And then liver, a lot of B12 also. And then remember, we do fortify our cereals with some B12 as well as the milk products. They're fortified with B12 too. Iron now. It's part of our hemoglobin, which is in our red blood cells. It's also a part of myoglobin, which is found in white blood cells. And it is used as part of many enzymes, and it's needed for the brain and the immune function. It helps to detoxify drugs in our liver. It also contributes to bone health. So iron deficiency anemia is the most common micronutrient deficiency worldwide. 30% of the world's population has iron deficiency anemia. And this can be caused by, let's say, growth. Okay, so somebody's growing very rapidly. They may need more iron in their diet. Or, for instance, if you have someone who is pregnant. So what happens with pregnancy is that the plasma in the blood increases. And so you have an increase in blood volume. And what that does is it decreases the concentration of red blood cells and the concentration of iron, so it makes it more difficult for oxygen to bind, and so that produces iron deficiency anemia. Blood loss, like for instance during menstruation, and you can also have blood loss from, let's say you have an ulcer or hemorrhoids, colon cancer, and those are usually long-term slow bleeds that create that type of blood loss. So this can change both the size and color of our red blood cells. So up here you see normal red blood cells, normal size, normal color. But blood cells with iron deficiency anemia are usually small and pale. So you see these red blood cells here, they have a little bit of the whitish looking in the middle because of where the indent is, but notice how much more pale all of these red blood cells are and how much smaller many of them are. And so you have microcytic and hypochromic anemia. So the symptoms, of course, fatigue, pale skin, they're always cold because remember, our blood carries our heat. Loss of appetite, reduced work capacity. So there are stages of iron deficiency, and stage 1, iron stores become depleted. So you don't really see too much of a big deal. Physiologically, maybe the person is a little bit tired, but it doesn't seem like any big deal. Now, stage 2 is the amount of iron in transferrin is depleted. Now, transferrin is the protein that helps to transport iron through the bloodstream. And now, because you're not seeing so much iron and your hemoglobin production is decreased, you're going to have some impairment. And not only is hemoglobin going to be decreased, but you don't have as much iron as a cofactor for many enzymes. So those enzymes are not going to be working and metabolic reactions are slowing down. Stage 3, the red blood cells now look microcytic and hypochromic, and their oxygen carrying capacity has declined. So males and postmenopausal females have a recommended daily allowance of about 8 milligrams per day. Females between the age of 18 to 50, about 18 milligrams per day. The average intake is only about 13 milligrams for women, but about 18 milligrams for men. So during pregnancy and childhood, the demand for iron is higher, and the risk for iron deficiency anemia is higher. So the absorption and the distribution of iron in the body depends on 3 factors. So number 1 is how much iron does the person have in their system, and then what is the form of iron that they're eating in their food. Are they eating a form of iron called heme iron, or are they eating non-heme iron? So we'll talk about heme versus non-heme. And then other dietary components that are found in food, such as large doses of zinc, compete with iron absorption. And body iron loss is usually minimal. We don't typically lose iron unless there is a bleed. All right, so what's the difference between heme and non-heme iron? So in animal foods, iron is attached to proteins called heme proteins, and so we refer to this as heme iron. In plants, iron isn't attached to any of those heme proteins, and so in plants, this is non-heme iron. So dietary sources of heme iron would be meat, fish, poultry. Non-heme iron then would be like our vegetables and our fruit. And then, of course, fortified foods have non-heme iron in it, and supplements are going to have non-heme iron. We're getting these supplements from plants. So some food sources of iron would include, for instance, the cereals, which are fortified, again, so frosted mini wheats, there's a big one. And then spinach is going to have a lot of iron in it. You probably know about that because of Popeye. And oysters, lots of iron as well. So these are some good sources of iron. Steak, some people talk about steak having a lot of iron in it, but in comparison to, let's say, even a baked potato, steak actually has less iron. Avoiding too much iron, the upper limit is about 45 milligrams per day. Now, some doctors are going to recommend 60 milligrams per day for people who have iron deficiencies, but you shouldn't be taking more than 45 milligrams per day if you don't have those iron deficiencies. One of the things that can happen is stomach irritation, and that can be a bad irritation, even leading to ulcers. And iron pills are common causes of iron toxicity in children who accidentally overdose. So you got to be careful of having like those chewy vitamins or chewy iron around, because kids think these things are candy. Vitamin C increases iron absorption, so this is a problem for people who have hemochromatosis, which is a disease where they have too much iron in their system and they hold too much iron. So having vitamin C and iron intake at the same time is not considered a good thing. Five, four, three, two, one. So let's talk about copper for a little bit. Copper is a cofactor for many of our enzymes. It is also a component of blood. And there is a protein that helps to carry copper called ceruloplasmin. And this helps to carry copper throughout the bloodstream. And copper, its role with enzymes involve helping to create this cross-link kind of connective tissue protein similar to collagen. It helps with nerve myelination, neurotransmitter synthesis. It assists enzymes in immune function, blood clotting, and then even fat metabolism. So copper increases iron absorption, and we talked about it helps with the formation of connective tissue. It also functions with an enzyme called superoxide dismutase, which is an antioxidant. And then again, we said copper helps with blood clotting, the immune system, brain development, and even fat or cholesterol metabolism. So sources of copper would be liver, legumes, seeds like our sunflower seeds, whole grain bread, cereals, and even cocoa. And a deficiency, now by the way, for the cocoa, it needs to be the more darker chocolate, the better the amounts of copper. Deficiencies would cause a type of anemia. You'd have low white blood cell count, poor growth, bone loss, and even some cardiovascular disease that can occur. So that dark chocolate is a good source of copper. That candy containing 53% cacao solids provides about 1,400 micrograms of copper, or 72% of your daily value. So don't forget that dark chocolate. So the recommended daily allowance of copper is 900 micrograms. The upper limit is about 10 milligrams per day. Most people don't take that much copper or eat that much by far. Again, liver, a really good source of copper, and walnuts. You also have cooked spinach, soy milk, blackberries. All of these very good sources of copper. You want to avoid too much copper. More than 10 milligrams can cause toxicity in just a single dose. And so usually this overdose is going to come by supplements, and that's going to cause gastrointestinal distress, vomiting blood, tarry stool, damage to the liver and kidneys. This is not good. Toxicity of copper is, again, 10 milligrams per day. This is not very common, but there is something called Wilson's disease. And this is where the liver cannot synthesize that protein that's going to carry the copper. So copper then accumulates in the tissues, like the lungs and the liver, and can cause damage. And so you get damage to the lungs, you get damage to the liver. Now, what happens when you talk about also damage to the nervous system is you're talking brain damage. And I don't know if you have been able to see any videos on this lady. This is Eileen Warnicki, and a lot of people believe that she had Wilson's disease. So one of the things about her that you can see is, number one, there's definite neurological damage, and this woman is one of the infamous female serial killers in the United States. And her brother and she both lived in a copper mining town. And her brother had Wilson's disease. She was never tested for it, but a lot of people believe that she had it because as you watch her in her videos, one of the symptoms of Wilson's disease is that they don't blink. And she doesn't ever blink. Now, of course, she has been executed and her body was burned, so there was no way that anyone was allowed to even test for copper toxicity. But it's very interesting that that could have caused the severe neurological damage. Now, of course, the treatment is a vegan diet. So eat your fruits and vegetables, and that has very low copper levels. And of course, don't take high doses of your supplements with copper. All right, so let's talk now about the neurological system, the brain, the spinal cord. A little food for thought. This is a very metabolically active organ. So 20% of all of the oxygen that we inhale is going to be used by the brain, and the brain uses a lot of energy in the body as well. So it requires continuous energy source because it's very high demand, has a need for a lot of nutrients in order to have good, proper cognitive function. So when you look at the brain, it's about 60% fat by weight, which is kind of interesting. So nutrient and formation of brain tissue, we're talking about fatty acids, and we're talking about a chemical called choline. So omega-3 and omega-6 fatty acids are two essential fatty acids, or two types of fatty acids, and these include the two essential fatty acids, which is the alpha-linolenic acid and alpha-linoleic acid. And we talked about this in videos a long time ago. And these are used to form the phospholipids, which are very important in maintaining healthy cell membranes. And you need those healthy cell membranes in the neurological system because those membranes are going to help to transport the electrical information from one neuron to the next. So one of the nutrients that is needed also along with the fatty acids is choline. Now, choline, depending on who you talk to, is or isn't a type of vitamin, but this is vital for the synthesis of those two phospholipids called phosphatidylcholine and sphingomyelin, and it is very highly concentrated in the nervous system. We also need iodine and iron for brain tissue. And iodine participates in myelination of the nerves in utero and also shortly after birth. And so maternal iodine deficiencies results in cognitive deficiencies in the infant and may even lead to severe mental retardation. So iron deficiencies participate in pathways that fuel the brain, and it helps in myelination of the neuron and then formation of certain neurotransmitters. If you have a deficiency of iron, then brain growth and development is impaired. And so your person may have behavioral issues, you may have issues like ADD, simply because mom was iron deficient as baby was growing in utero. Now, nutrients that need to fuel the brain. One of those nutrients is glucose. So in a typical American diet, glucose is the preferred fuel for our brain and our nervous system. And what I mean by preferred is this is the one we prefer to give it. So the brain relies on glucose in order to function. So now during fasting, that's when let's just not say you're fasting for days at a time. Let's just say that you ate dinner at, I don't know, 6 o'clock in the evening, and you didn't eat breakfast until 7 o'clock in the morning. So you've been fasting for over 12 hours. When you fast like that for over 12 hours, you don't have a lot of carbohydrates or glucose in the system. And so what has to happen is your liver starts breaking down glycogen. And glycogen is a storage form of glucose. And then also the liver and the kidneys start converting amino acids to glucose in order to be able to use that to power the body. Now, if you have an ongoing, not just overnight fasting, but you have an ongoing low carbohydrate diet, the brain is then going to switch from using glucose as its primary source of energy to using ketone bodies that it gets from fatty acid breakdown. And those ketone bodies are going to are going to provide the energy that the brain needs. Now, you don't want these ketone bodies to get too high because you can go into what's called ketoacidosis. Now, usually we don't see super high levels of ketone bodies in someone who is just on a regular daily basis eating a lower carbohydrate diet. Let's say, for instance, they're eating 100 grams or less of carbohydrates in their diet. Again, you're not going to see somebody hit ketoacidosis. Where we see ketoacidosis is when somebody is on a starvation diet or when someone is diabetic, because a diabetic person, they're not able to utilize those carbohydrates as energy, and the body turns to purely burning fat as a fuel. And so they were burning fat too fast and were producing too many ketones. So metabolism of glucose requires micronutrients, okay? So we have to have those vitamins and minerals so that we can have adequate brain function. Thymine, riboflavin, niacin, pantothenic acid, biotin, you see all your B vitamins, iron, magnesium, manganese, vitamin B12, even vitamin B9. These are all very important in helping to keep brain function going. So, by the way, if you remember, or you might want to look back up what magnesium is all about, ATP production is one of the big deals with magnesium, and that is a big deal for fueling the brain, just like your B vitamins are. So metabolism of glucose requires many micronutrients. You've got to have those B vitamins to get that glucose to turn into ATP. And you can't do that if you have deficiencies of all of these different vitamins. So communication is occurring, of course, between the brain and the body tissues, and we're using the nervous system in order to be able to do this, and we're using what we call nerve cells or neurons, and they are carrying electrical and chemical signals throughout the body. So these electrical signals have to do with levels of sodium and potassium crossing that healthy cell membrane. And the electrical signals can be sped up when those neurons are covered with an insulation that we refer to as myelin. So in order to make sure that that myelin covering is very healthy, you're going to need thymine, folate, vitamin B6 and B12, and iron to keep myelin sheaths healthy. So also to carry the message from one neuron to the next, you remember the neuron secretes a chemical messenger called the neurotransmitter. And those neurotransmitters quite often are made from amino acids. So having the right amount of amino acids in the diet is very important for neurotransmitter production. We also depend on our B vitamins again to help us with neurotransmitter production, especially having the neurotransmitters made in the neuron. We need enzymes and ATP to do this. So again, thymine, riboflavin, niacin, B6, folate, B12, all involved in these chemical messengers. So antioxidants are going to help to protect the nervous system and phytochemicals, and so they're going to protect from oxidative damage. And we've talked about vitamin C, vitamin E, selenium, zinc, and even beta-carotene as good antioxidants. High levels of homocysteine, not only have they been identified as risk factors for cardiovascular disease, but also for Alzheimer's disease. Excess body fat starting in childhood also seems to negatively impact cognitive function, and that usually equates to a very poor diet. Now, it's very interesting. So one of the ways to look out for problems with the nervous system is to look out for insulin resistance. So we've talked a little bit about insulin resistance, and this is where receptors on the outside of your cell are going to down-regulate, and that means they're just not going to exist outside of your cell. They're going to move to the inside so the insulin can no longer bind to those receptors, and now you can't get the response you need. And so your body feels like it's starving, and it tells you that you need more sugar. So insulin resistance is a mediating factor in the relationship between excess body fat and brain health. So one of the things we know is that the more sugar you eat, the more downregulation of those receptors occur. And when that happens, you have more of an issue in brain health. And we're not sure what exactly the correlation is and how this is occurring yet, but we do know that, for instance, like Alzheimer's disease is now becoming a diabetes type 3 disease. And so having this excess sugar in our diets is extremely bad for us. Another thing that's going to improve brain health is physical activity, because, of course, physical activity increases blood circulation, and that allows for more oxygen, for more nutrients, vitamins, all those types of things hitting the brain. Now, we've already talked a little bit in the last video about folate and the neurological system, but just kind of as a review, if there are maternal deficiencies in folate, we can have problems in the fetus in having issues such as spina bifida and anencephaly, because the neural tube does not develop appropriately and it doesn't close appropriately. So it's recommended that 6 weeks before pregnancy, women should be taking 400 micrograms per day. So that means if a woman is in those years of being able to become pregnant and thinks that she can become pregnant, she should be taking her vitamins, because those neural tube defects are very damaging to the child and potentially could even cause death. Vitamin B12, we've also talked a bit about this before, but as far as the neurological system is concerned, it helps in that myelin sheath formation that insulates our neurons. And neurological symptoms from a deficit of B12 could be destruction of that myelin sheath. We also have impaired muscle action, impaired reflexes. Eventually, someone can develop paralysis and even death. So looking at brain health, really it's important to start during gestation. So while that baby is still in utero, brain development is going on, and so mom has to have adequate nutrition for the baby to grow appropriately. And again, folate, B12, but also enough omega-3 fatty acids and iron have all been related to improved cognitive function. Migraine headaches also have a lot to do with eating. And so they've looked at studies with migraine headaches and what people eat. And of course, some patterns of eating can increase the frequency of these migraine headaches. So you get these very severe headaches, throbbing pain, sometimes even flashing lights on the side of the eyes. The person can't look at the light. It makes everything worse. This affects about 38 million adults and children in the United States alone. And of course, you know, that's going to interfere with your quality of life, especially if you can't even go outside. You have to lay in a dark room on your bed until the migraine goes away. So most commonly, the triggers are a high carbohydrate diet. So having a low carbohydrate like a ketogenic diet is highly effective to lower migraines. And then also chocolate, cheese, certain citrus fruits, alcohol, coffee, all seem to be dietary triggers. Now, some studies have been done on looking at different diets that could help prevent neurodegenerative diseases like Alzheimer's. And they came up with one called the MIND diet. And basically, the MIND diet is a combination between the Mediterranean diet and the DASH diet. And so the Mediterranean diet is a diet where you are, where you're eating very nutritious food. So a lot of home cooking is going on, and that home cooking is not including any type of really pastas or breads. It is a much more low carbohydrate diet. It doesn't include any type of frozen foods. Everything is fresh vegetables, fresh meats, and the DASH diet is a low sodium diet. Now, the other thing too about the DASH diet is that there are intermittent fastings that are going to occur for the person. So you're on this low carbohydrate diet, very similar to the ketogenic diet, except that you also are allowed to eat your vegetables, okay? And so you don't have to really worry about those. So there's a lot of good fats in the diet, and you're also eating your vegetables and to some extent fruit, but not overly consuming fruit. And then you're also doing the intermittent fasting, and you're also doing low sodium diet. And this has been very successful in preventing neurodegenerative diseases. So 10 brain healthy foods would include your green leafy vegetables, number one, and then of course other veggies, nuts, berries, beans, fish, poultry, olive oil, and wine. Now typically when we talk about wine, most of the time we're talking about red wines in this. And then 5 foods to limit would include red meats, margarine, cheese, pastries and sweets, fried or fast food. Now, as far as those red meats are concerned, one of the questions is this a need to limit the red meats if these are pasture-fed and if those meats have no dyes or preservatives added to it? So we don't really know the answer to that at this point. So some of the warning signs for Alzheimer's: recent memory loss that affects job performance, difficulty performing familiar tasks, problem with language, faulty or decreased judgment, problems with abstract thinking. Warning signs: tendency to misplace things, changes in mood or behavior, changes in personality, loss of initiative, withdraw from work or social activities. Those are all beginning signs. But now you can see with all of these, okay, that doesn't necessarily mean Alzheimer's disease. You could have difficulties with brain function because of nutrient deficiencies. So it's kind of difficult to say, but again, you have to be very careful. And now the question, the hope is, can you prevent this Alzheimer's disease with proper nutrition? So brain healthy nutrients and phytochemicals in whole food have synergistic effects. So they can work together. For instance, B6, B9, B12, they keep homocysteine levels in check. Vitamin E and C work as antioxidants to decrease inflammation. And then fatty acids in fish oil are important in brain function because those are your like omega-3s and 6s. And I just thought that that was an absolutely beautiful picture of the Grand Tetons in Wyoming. Thank you for listening to this video. See you next time.